She has irregularity here, and I could feel her bones. She's never had surgery. She's never broken her nose as a kid. And you could see the mobility of the nose here. So at the same time, when I take a look at her, would she benefit from filler? As I run my fingers down, I asked her, I said to her, if we put filler here, it will make her nose look wider, as opposed to, see how the width of her bridge is already? If you put filler here, it will actually take away from her supratip break that everyone wants to get. So I don't want to obliterate that. Do you see from an aesthetic standpoint? We want to maintain that supratip. That being said, what she wants, bless you, is more of a straighter bridge so that you don't see so much of this hump, which you could surgically shave down. So if we put a nose thread up this way to help pull up the nose, and then we put, see how she has more of a collapsed columella, a protruding columella? So you can surgically lift that with a closed rhino, but that's surgical from the inside of the nares. Or you actually can go ahead and use PDO thread to straighten this out, and it gives her that better of a look, right? As far as the nose here, if she is bothered by this, but she doesn't have a lot of nasal flare, you could put a unit on each side, or you also could put a unit right here. But now we're not going to do a chemical lift just because of the fact that what? It's not immediate. It takes a while to kick in, a couple weeks. So we're going to do the PDO threads for her, all right? Does she need filler? No. So this kind of a patient is not a candidate for filler. You okay?
Yeah. Oh my God. Oh.
I literally put 0.1.
Who's next?
I actually have to isolate the nose. Why? The entry point that I make, I need to make sure that it's central. In this situation, I have to be very much more strategically in placing of where the entry point is. As you saw earlier, I made an entry point here, but I was able to redirect and go in different directions for the tear trough. In the nose with these U-hooks, because I'm not going to disengage or pull the thread out, when you go in with the U-hook, by the way, you can't take those threads out. So if you put it a little to the left, a little to the right, and you engage it, you're going to make her nose more deviated. So this is the reason I'm holding the nose in the middle, central. I'm going to sharp or dull. You okay? This is an 18 gauge to make your entry point. You see how big that is?
No, not because
This is a 19 gauge 38 millimeter. This is a U-hook thread.
Okay? Yeah. It's uncomfortable. Oh my goodness.
I don't know.
Slow down. Slow down this one.
You okay?
Yeah.
Don't make that nose shape.
Okay.
Set up.
Mm-hmm.
Do you have her picture? I'm sorry?
second one?
It narrowed it because it pulled it up. Correct. I'm just making sure it's engaged because what I want to do is now I'm going to put it down this way before I decide if I want to add more. Sometimes you only need one to just pull the whole thing up. Thank you. Lean back. Okay. Okay, relax.
uncomfortable.
Sit up. So you can see the columella? Do you guys see the difference of her drooping columella from before, how that picked up from here? It was down here. Do you guys see that? And actually, I'll be honest with you, she doesn't need more than that. It hurt, but the nose is not the most comfortable thing. Do you see that? You remember your tip was down here? This is your columella. You guys saw me go in this way and then redirect down. Did you guys see how I pulled up to give myself space? I literally went into her philtrum. You have to be very careful in that area, but that's where it needs to be delivered. Because of the U-hook, by me pushing up this way, it's giving her support that way.